Hello, my name is Paul McArdle. I'm Deputy Medical Director at University Hospitals NHS Trust, Plymouth. I'm here just to talk to you and update you on our plans for next week as we prepare for next week's industrial action. This will be when some of our junior doctors will be taking part in a 72-hour strike. This will begin on Monday morning at 7 a.m. and it will finish at 7 a.m. on Thursday. As an organisation, we will continue to support people's right to strike and have their voice heard, and of course we'll continue to support our colleagues who are working. We recognise this is a sensitive issue both inside and outside the organisation, so I just wanted to say thank you to our staff who are working hard to support one another in terms of preparation as we approach these days, and also to the general public who we will be working with to ensure that we deliver the right care to the right people in an effective and safe manner. At the moment, we are planning on the basis that the industrial action will go ahead. That's by no means certain, but at the moment it is likely. And we will, of course, let our staff and the general public know if the strikes are cancelled. So at the moment, we have begun the job of contacting patients to postpone outpatient appointments along with some elective procedures. This will be taking place on a daily basis from today and continuing until Thursday the 16th of March. And we will be doing this on the basis of information as we receive it and what is required. Our aim in our planning has been to strike a balance between delivery of urgent care whilst ensuring life-saving procedures can be effectively managed and delivered. Of course, this isn't a decision we've taken lightly, and it's one that we need to be able to ensure we provide services safely at the same time as enabling us to focus on acute, inpatient, and urgent and emergency care. Our priority ahead of Monday has been to create as much capacity as possible. And with that in mind, we are asking our staff to continue to review and discharge patients appropriately who no longer have an acute clinical need to be in hospital and who could be safely managed in another environment. We, of course, will need to work closely with the general public, and we have several asks of you. Of course, it remains really important that you attend our emergency departments for serious, life-threatening conditions that need immediate attention. This includes persistent severe chest pain, loss of consciousness or altered confusional states, severe blood loss, serious burns, suspected stroke, breathing difficulties that are severe, or deep wounds. All of those, plus others that may you may come across, represent emergencies that we really need to see. So we ask you to come. However, if your condition is not an emergency, then we would ask you to work in partnership with us to try to reduce the demand on the organisation so that we can provide safe, effective care. Please help us get your relatives home. If your relative is in hospital and ready to go, please collect them as soon as you can, as that will facilitate the beds becoming available. Where it's necessary, think 111. So if you think someone, or i.e. yourself, or someone you look after needs to attend an emergency department, please call 111 first, as they'll be able to give you advice and support if other aspects of our care facilities across the city might be able to provide you with that care in a more timely fashion and in a more appropriate way. Please be aware, if you attend our emergency department, that you will be assessed, but you might be redirected to another service if it's more appropriate to your current need. In that way, we can ensure that we can provide you with the best possible care in a timely fashion in the right place. Please be patient. Our staff will be working incredibly hard to care for you and for other people who are there in the emergency setting. So we will be grateful for your consideration and patience whilst we're working our way through what I think is going to be quite a difficult time. Finally, please make use of other options available to you, such as using your GP, your local pharmacy, or making use of our minor injuries unit at Tavistock and Kingsbridge hospitals, or through the emergency treatment centre at the Cumberland Centre in Devonport.